Hello, my name is Landon Truelove. Me and my peers are students in the Nurse Anesthesia program at the University of Arkansas for Medical Sciences, and today we will be presenting on a paper entitled Magnesium Sulfate Enhances Analgesia as an Enhanced Recovery After Surgery Adjuvant for GI Surgery. This presentation will follow a sequential order so the listener can see the screen and follow the poster from left to right as we go along for more information. The background of this study and what we attempted to look at is following a clinical practice guideline written by the ERAS Society, which is an international society of anesthesia providers that look at how to improve care when morbidity and mortality could be decreased in particular surgical specialties. This one looked at gastrointestinal surgery, which has a morbidity rate of about 13 up to 13.8% in the US. And this guideline sought to find various ways to improve the care during GI surgery. The particular measure that we looked at in this research review, literature review, is the analgesia associated with GI surgery. The research question is that in patients 18 to 65 that are undergoing GI surgery, does administration of intraoperative IV magnesium sulfate along with opioids decrease postoperative pain scores when compared to opioids alone, which is the standard of care in most GI surgical suites? As I stated before, the morbidity is quite high in GI surgery. And so the background and the purpose of this study is how can we improve that, and how can we improve the overall experience of receiving GI surgery in the US by decreasing pain. The ERAS guidelines submitted by these authors can be found in our references, and essentially it omitted the use of magnesium sulfate as an analgesic adjuvant while having a multitude of other analgesic modalities in spite of the current evidence for magnesium sulfate. So this study that we performed was in an effort to look at the data and the research available for magnesium sulfate's use in preventing pain in gastrointestinal surgery and whether or not it would be a benefit to our patients.
A literature review was conducted, and the concepts magnesium sulfate, opioids, and postoperative pain scores were identified as concepts to search. And medical subject heading terms and synonyms were included that were appropriate to those concepts. And search filters used to narrow the database searches included age, English language, and recent publication. A search of PubMed database yielded 337 records. And with filters applied, these records were narrowed to 27 relevant records. A search of Thinol database yielded 104 records, and these results were narrowed to 16 records with filters applied. A search of Web of Science database yielded 165 records, which was then narrowed to 47 records with filters applied. Accounting for duplicates, these database searches yielded 73 unique records, and these 73 records were then screened by the researchers for their inclusion in this clinical practice guideline revision. 15 RCTs were chosen for inclusion. The remainder of the records were excluded based on their lack of relevancy to the clinical practice guideline, research question, or for other reasons.
The outcome of 13 out of 15 studies supported the research question and determined the addition of intraoperative IV magnesium sulfate administration in lowering pain scores postoperatively. However, among the articles reviewed, 2 studies revealed that remifentanil and morphine versus magnesium sulfate displayed that those who received magnesium sulfate had significantly lower pain scores. One study compared inhalational agents during maintenance alone and in conjunction with IV magnesium sulfate. Results yielded those receiving magnesium sulfate had significantly lower pain scores. However, 2 studies opposed the research question and found no statistically significant difference in pain scores when comparing 0.9% normal saline to IV magnesium sulfate.
After a thorough review of the evidence-based literature, this collaborative learning community has reached a consensus to answer our initial research question. In patients 18 through 65 years old undergoing surgery, the administration of intraoperative magnesium sulfate in conjunction with opioids significantly reduces postoperative pain scores in comparison to those patients who only receive opioids. Additionally, the evidence leads us to, without reservation, recommend the addition of magnesium sulfate to the Enhanced Recovery After Surgery Clinical Practice Guideline to better manage pain postoperatively.
As Doctor of Nursing practice graduates in a nurse anesthesia program, this is an intervention that we will be able to incorporate into our daily practice. The certified registered nurse anesthetist is often the primary provider of pain relieving measures in the surgical patient from both the preoperative area to the postoperative. So by utilizing multimodal analgesia techniques such as intravenous magnesium sulfate, we are decreasing the use and need of narcotics and promoting enhanced recovery by increasing early mobilization and nutritional milestones. So from the various research studies that we have evaluated, this intervention is factually supported for not only gastrointestinal surgical procedures, but also for various other procedures that we are involved in on a day-to-day basis.
Here you can see on the left a table from the ERAS Society written by Feldheiser et al. In 2016, and the little red addendum that we included of where we might add magnesium into the guidelines of this clinical practice guideline. And then on the right, these are our current recommendations, updated recommendations, and reasoning behind our current and updated recommendations for this clinical practice guideline. And finally, here is a reference slide for this literature review and the clinical practice guideline update.